Jakarta has decided to reimpose large-scale social restrictions or PSBB starting on Monday, September 14, after the city's governor Anies Baswedan warned the hospital system was on the verge of collapse and that the Indonesian capital was facing a COVID-19 emergency. But the curbs are more relaxed than when they were first implemented in April, leading experts to doubt the policy will bring down cases and deaths in the capital. Coronavirus infections have been soaring for 2 weeks, with doctors across the city's 67 COVID referral hospitals warning almost 3 weeks ago they were close to capacity and already turning away patients for lack of beds. If there is no emergency break, the hospitals will be full.
Anies Baswedan has made the announcement on Wednesday night, September 9, urging Jakarta's 11 million residents to stay home and don't leave Jakarta unless it's very necessary.
Dari 3 data ini, angka kematian, keterpakaian tempat tidur isolasi, keterpakaian ICU khusus COVID menunjukkan bahwa situasi wabah di Jakarta ada dalam kondisi darurat. Maka dengan melihat kedaruratan ini, maka tidak ada banyak pilihan bagi Jakarta kecuali untuk menarik rem darurat sesegera mungkin.
The implementation of the PSBB will last for 2 weeks and can be extended. There were several regulations that had announced by the governor on Sunday, September 13, before the PSBB restarted. Now the streets in Jakarta look more deserted than before the impose of the PSBB. Workplaces in 11 essential sectors, including health, food, energy, communications, finance, logistics, and daily needs retail, will be allowed to remain open at 50% of capacity, while private companies outside these sectors, as well as government offices, must implement work from home policies and allow no more than 25% of their employees to work in the office at the same time.
The decision to implement the PSBB received many responses. Mas Dalina Pane of the Indonesian Epidemiologists Association said, "There is no difference to the past 6 months. I am confused as to how they could distinguish between the 25 and 50% capacity." She expressed doubt that the measure would reduce COVID-19 transmissions, saying that now, with new cases reaching thousands, all people in the affected areas should be required to stay at home.
Ya, saya kira aturannya sudah ada ya. Aturannya sudah ada, tetapi menurut saya harus lebih ketat karena kondisinya tidak sama seperti PSBB yang pertama. Saya takut terjadi seperti PSBB yang pertama. Mereka berpindah kembali ke kampung halamannya, kemudian menambah kasus di wilayahnya masing-masing. Ketika Jakarta dibuka kembali, mereka kembali lagi ke Jakarta dan Jakarta menjadi tinggi lagi. Itu seperti ping-pong transmission gitu.
The government's spokesperson for all things COVID-19, Wiku Adhisa Smito, said during the press briefing that Jakarta's decision to reimpose the full PSBB had been coordinated with the National COVID-19 Task Force and the central government. President Joko Widodo said the plan should be well and cautiously calculated. One of Indonesia's richest men, Budi Hartono of tobacco company Jarum, sent a letter to the president on Friday expressing his objection to the plan and citing data that he said showed that the PSBB policy has proven ineffective in reducing infections in Jakarta. A biostatistics researcher at the University of Indonesia's School of Public Health, Iwan Aryawan, who has been analyzing data for Jakarta, expressed thought that the new PSBB phase would lift the proportion of people staying at home to the desired 60% to suppress transmission. In that case, the government had to ensure that at least 85% of the people who do not stay at home follow health protocol regarding face masks, frequent hand washing, and social distancing. But even such restrictions and health campaigns, experts said, would not be enough to reduce transmission without improved isolations and contact tracing. Iwan said the health ministry's protocol had to be changed to require that all close contacts be tested right away, rather than just being advised to self-isolate for 14 days, and even if isolation was suggested, there should be tighter monitoring.
Although there are many assumptions that the re-implemented PSBB will be less effective, but hopefully by the end of the reimpose of the PSBB, the COVID-19 cases and deaths in the capital will have decreased. That's the information. Have a great day.